Good afternoon, everyone. Welcome. I'm Paul Irwin. I'm Dean of the UAB School of Public Health, and I'm excited to welcome you today to our Fall 2022 Career Conversation with alumna Dr. Toya Burke. I know that we have some virtual attendees in addition to in-person guests in this room. And so for everyone joining us online, if you have questions for our speaker, feel free to post those in the chat box. We'll address those and any questions from our in-person guests towards the end of our conversation today. Now, without further ado, I would like to introduce Dr. Toya Burton. Dr. Burton is Chief Operations Officer at Whately Health Services Incorporated and an adjunct professor at the University of Alabama. Having received degrees from Alabama A&M University, Life University, and an MPH from the School of Public Health in 2008. Dr. Burton is one of the few chiropractors in a community health center in the country and works on several research projects. I can tell you, having visited and spent time in many rural community health centers, certainly across Tennessee and other places in Alabama, he is indeed a rare person. A strong advocate in health and pain education and health disparities, Dr. Burton has presented research to the Patient-Centered Outcomes Research Institute, the American Psychological Association, the National Institute on Minority Health and Health Disparities. She serves on various boards, was a member of the 2020-2021 class of Leadership Tuscaloosa, and is the first African-American female to serve on the State Board of Chiropractic Examiners. Dr. Burton is a breast cancer survivor and past recipient of the American Cancer Society's Excellence Award for Advocacy and a recipient of a 2021 UAB Excellence in Business Top 25 in Business Excellence Award. Dr. Burton, thank you so much for joining us. We are so proud of and for you, and so glad that you could join us for today's career conversation. So to begin with, beyond what I just gave to our audience, tell us a little bit about yourself, where you work, and your primary responsibilities.
Thank you, Dr. Irwin, for that introduction, and thank you for inviting me here to back home. Really, this is back home, School of Public Health. I remember these hallways vividly. Again, I work at Whately Health Services. It is a community health center in Tuscaloosa, Alabama. We cover 8 counties within West Alabama. We have about 12 locations within West Alabama. And I started there as part of the National Health Service Corps. I knew nothing about the National Health Service Corps when I was an undergrad, nor when I was in chiropractic school. And so internet had just gotten started. This was about 2002, don't laugh. Internet had just gotten, started really good in the early 2000s. And so somehow I found out about the National Health Service Corps, and they were doing a pilot program. And so I applied for the pilot program. I was one of 8 in the 2005 class of that pilot program to do the loan repayment. And I had to work in a rural area, which Tuscaloosa, most Alabama is considered rural. So that's how I got my start at Whately Health Services. So a lot of my responsibilities as COO, also I see patients from a chiropractic standpoint a couple of days during the week. So I have a lot of it may range from computers being out to pulling out to reviewing contracts. That's a lot of work.
That is. And for those of you who may not be familiar with the National Health Service Corps, this is a federally funded program that supports the designation of primarily physicians and dentists, although there are some other healthcare providers, to to locate in rural areas, usually in a federally funded community health center or a federally qualified health center. And then they pay for your medical school or dental school, and in exchange, you agree to locate in a particular area for a certain period of years. And the hope is that people will stay on after their service requirement. Including doctors of chiropractic, only took place in this pilot year. And so Dr. Burton took advantage of that. And as I commented to her earlier, she is a National Health Service Corps success because she stayed. It's exactly what they wanted to do. So congratulations for that. So tell us a little bit more about your career path. What made you decide to pursue an MPH after you received your Doctor of Chiropractic degree? And how did you get to where you are today?
I don't think we have enough time. I decided to do an MPH, sit in my private office. Before I started at Watley, I had a private practice. And private practice is not easy. First, you got to get a loan or have money to buy equipment. And part of my challenges and part of my successes is I did not know much about credit scores then. I do now. I did not know it then. And I was newly married, just had a baby. And I was trying to figure out how do I start a private practice. And so I went to 7 banks, not knowing every time they pull your credit score, they're needed. And I did not have no clue. Went to SBA, did the class, but they did not tell you that part. And so at the end of the day, because I did not have much collateral, I could not get a private loan to start a business. And so with the donation or gift of a family member and a friend, I started my practice on $2,000. With my baby in tow and some friends to help me, that's how I started my private practice. And so I was thinking, okay, the chiropractors that I had shadowed through my years of school and while out of school, I always heard the same thing. If you get hurt, your hands is your money. Hands are your money. And it's the same thing for medical doctors. Your hands are your money. And if you got hurt, what are we going to do? Arthritis kicks in really bad in your hands. But chiropractic, we got to perform a certain, move our hands a certain way to do an adjustment. And so I said, okay, Jordan, long range, if this thing doesn't work out, what you going to do? Mind you, I just came out of school, and at the time I came out of school, I had a $113,000 in student loan debt. And so I was not going to pay that back. So I started searching and found out UAB had a general theory for people with terminal degrees, doctoral degrees. And so I applied, and my doctoral degree was a typical doctoral degree for the program here. And so I had to talk to Dr. Minimine. And I talked to him on the phone a couple of times and convinced him that I would be a good candidate for the School of Public Health. And so that's how I ended up here.
I don't know if Dr. Minnemeyer is online. I hope he is joining me today to hear this. Well, you alluded to this a little bit in your opening comments, but tell us more now, sort of fast forward at Watley. What does a typical day look like for you? Or is there such a thing as a typical
No, there's no such thing as a typical day. If I had one small thing to do every day, I would not know what to do. I can be coming in the clinic and as operations officer, it covers a lot. And my job is to move the strategic thrust of the organization with the guidance from our CEO. And so I have to assist him in whatever his vision is for the organization, carry that forward. By the same token, if, like I said, like today, typically, it's a rainy day in one of our rural areas, the internet went down. So I get an email about the internet goes down, I have to notify the staff in those rural areas that their internet is down. So it may be internet is down, it may be talking to our attorneys in regards to contracts, it may be visiting with local, presidents of universities or president of, junior colleges, it may be talking about community engagement. I am on I kind of co-manage 2 projects. So it may be meeting with my team in regards to what that look like, what's the status on the projects, how many patients we have enrolled in a hypertension study or a pre-diabetes study, or sitting on what's called a GPE, which is a research project we have with the University of Alabama right now. So looking at how many patients we have or what patients, how can we do something better, engaging patients in mental health therapy. So it varies. It totally varies. Emails that someone wants COVID. COVID was a total blur to me. I served at that time for 2 years as the interim medical officer of Watson. So that was during the COVID time. So I was pulling patients report, calling patients, contacting them about COVID at the time in the beginning, we didn't know what to do. So I my whole public health thought came up. I was like, this is wonderful for a public health student to be in this right now. But I had to, learn how to manage that whole COVID piece. What does that look like? Contacting patients, telling them about isolation, leading our team, creating a team so that we can do what we needed to do to take care of the patient and the public that may be impacted by that patient having COVID. So it ranges. It ranges. And then I see patients a couple of days later.
And you see patients. You mentioned research, some research projects, and I alluded to the Corey project that you did previously. But tell us a little bit more in detail about the research you're doing now, research projects you're involved in.
So the main research project we have right now is what we call GPE, is Graduate Psychology Education. And so it's with the School of Psychology with Rebecca Allen and some of her team. And so this is what we call number 2, and it's funded by HRSA. And we are trying to get people with substance use or OUD, SUD, bring them into care, into therapy with a postdoc student. And so I pulled in our social work staff. My social work director, Jennifer Rose, is doing an excellent job in trying to corral our social work first at Watson, and also patients who have OUD and SUD to give them another option to kind of pull therapy into it. They have one-on-one therapy with a postdoc student and trying to help scale down the type of amount of OUD and SUD that they do, or trying to cut it out all free. Like to cut it out, but reality is a lot of times we have to scale people down so they don't have these lows, these highs when it comes to just their everyday health. So that's the main one we're doing. Then we have a couple of small grants that are huge. It's not a research project, but we're giving money to help patients with blood pressure issues. So as a community health center, we have what they call quality measures. All community health centers have quality measures that you have to complete. And so HRSA gave us some money to help patients with blood pressure by purchasing blood pressure cuffs for patients. So we have to be strategic with that and look at the fact that a lot of people we serve are in rural areas, and a lot of people who have blood pressure issues are elderly or seniors. And so they may not know how to use a smartphone. And so they want it to be Bluetooth capable. But we know a lot of our people don't have smartphones. So we had to figure out how can we find a company that has blood pressure cuffs that are cellular. So once they take the blood pressure reading goes to app or goes to a database. And so we have a coordinator who looks at the database and gets alerts and says, hey, Ms. Johnson did her blood pressure today, or Ms. Johnson did not do her blood pressure today. And so she can give them a call and say, hey, notice, Ms. Johnson, you haven't done your blood pressure in a couple of days. What does that look like? Or you have done it, but we know it's a little high. Kind of give them some conversation about that. Excuse me. And another thing that we're doing is the CDC project with the Black Women's Health Imperative, where we have been doing it since 2016, and it's for pre-diabetes, or NDPP for short, and trying to encourage people who don't have diabetes yet, but fit the parameters, may it be by family history or BMI, to try to change their habits, so therefore they won't acquire diabetes later on down the road.
Well, opiate use and other substance disorders, substance use disorders, hypertension, diabetes, you're hitting the big
three.
the big three in the state of Alabama.
Yeah.
That's potential for huge impact, particularly again in rural areas.
Exactly.
What do you feel are some of your proudest achievements? I know you probably wouldn't use that word proud because you're a very modest person. I know that already. But what are the things that when you look at what you've done, where you've come, what are those achievements that you find remarkable?
That's a good question. Nothing, I would say nothing of the achievements. Of course, the degree in chiropractic was partially planned. I was a student athletic trainer in college, and so I felt like I could combine that with chiropractic, so that's why I did that. And I knew I wanted to be a doctor. So the degree in public health was like, okay, what you gonna do if these hands don't work? How can you still blend some type of administrative role in healthcare with what you currently do now? And I always thought I'll be the perfect marriage between knowing some clinical and knowing some administrative. That way I can understand both sides. So accomplishments or achievements that I'm most proud of, nothing, the awards, the accolades that you talk about, none of that came by design. None of it. I talked about this when I did the keynote speech this year at the top 25. It was all divine destiny from the man above. None of this was my plan. I was, because of the Purpuri in 2016, I was on the front of the New York Times. A reporter came down, she talked to Dr. Beverly Thorne, who's the project PI, about pain, and that's huge for her, cognitive behavior therapy. If it wasn't for her, a lot of this would not have happened. And so to be on the front of the New York Times is like, wow. You would have written this script when I was 18 and told you that would happen. Never would have thought, never would have thought. So my biggest accomplishment to me is being at Watley to be a part of taking care of patients. To hear patients come, my boss jokes with me all the time. I only see patients a little while now. And I have some patients that come from Soldier, Alabama. I don't know where if you know what, anybody know what Soldier is? Never heard of them. Okay, I had night. Soldier is in far northwest Alabama, kind of between Vernon, Alabama, and Florence. I think that's right. So it's up that way. I have patients that come from Florence, that come from York, Alabama, to come see me. And he was like, these people come all over the place see you, and you be needing me every day. He just joking about me with him, but that's probably my most proudest thing, is to just try to help somebody be better. I, as a breast cancer survivor, I was told that at 36 or 37, 36 is when that happened, I was not going to make it to 40 to get a mammogram. And that was at the time when we were doing breast cancer month, doing classes, and I was the health educator. I did health education too, for diabetes and stuff when I was chiropractic full time. And so I would talk to people about getting mammograms and doing self-breast exams, not knowing I would have to add to my PowerPoint slide my own testimony. Not knowing then, 10 years later, I would have to be that testimony to my mother, who just recently went through breast cancer. So that is my biggest accomplishment to me, is to be able to say Yeah, I am a firefighter in an unordinary situation. And when people meet me, I say I'm a firefighter, and I was like, well, I'm not your ordinary firefighter. I'm a little bit different. And to me, that just shows you how various disciplines within healthcare, the medical doctors that I work with every day, the nurse practitioners, the dentists, the social workers, the pediatricians, how all of us can work together to take care of the patient.
Well, we certainly wish your mother all the best, and our thoughts and prayers will be with her. She
Thank you.
goes through whatever treatment process. Great, great. Health disparities.
Yes.
How do you look at, address, to reduce health disparities? And the flip side of that is, how do you promote health equity in your work? How do you communicate those things?
Very good question. Whiteley Health Services was founded on the bank premise in 1977 by a teacher named Mark Whiteley to help kind of curb some of those disparities in West Texas. And so it was pretty much a free clinic at the time. And that was 1977. Fast forward to 2022, and some people still think, wow, it's a free clinic. We are not a free clinic. We are a community health center, so we have to take something. But we try our best to take care of patients regardless of their ability to pay. That's our goal, person. So to try to even out that equity part and dealing with disparity, again, that was something I never thought I'd be dealing with. This is kind of a champion for disparities. When I was in undergrad, I knew nothing what health disparities was. So now, like, that's on my resume. I know about health disparities, and I see it every day. So what I try to convey to our staff, in particular our front desk staff, is that no matter how much this person pays, whether they pay $20 for a copay because that's what they are on the fly, versus they're paying $32.50 because that's their copay with Medicare or whatever, Blue Cross or whatever it may be, we get the same amount of care, period. Same thing. You get the same type of pap smear. It's not the deluxe pap smear or the medium-sized pap smear. It's the same pap smear. You get the same care for your diabetes. It's not the deluxe package or the gold or the premium or the silver. It doesn't matter. We give you the same type of care because you are a person. You are a person, and we have to take care of you as that's what you are. And so we try to help facilitate some of those disparities, whether somebody who does not have money for the medication. We have a PSP program, so the providers will write the prescription, give it to our PSP person, who is the patient assistance program, and help them apply to try to get their medication at a reduced rate. That helps to kind of, even out some of those disparities when it comes to getting medication. We're opening up our own pharmacy in the next couple of months. That's another project that's a COO. I have to work with our staff. And so that's one of our things I've been trying to tell them in the pharmacy piece. How can we maybe create our own little niche for those who don't have insurance to help them get their medicine at a reduced rate? Trying to make relationships with companies to get glucose monitors for patients. Like I said, the blood pressure cups, food insecurity is huge. So it's been times when we gathered stuff for a patient who had a fire in the house. But that brings about some depression. So trying to get them to maybe the social worker or the clinical psychologist for some counseling, and then maybe reaching out to some community partners to try to get some food or whatever it may be, some clothes. Sometimes we gather things together for patients and just give it to them. So when we talk about disparities and equality, I think we do a good job of trying to end those pieces because that's just our mission.
All of us, myself included, struggle sometimes with priorities. How do you among all of the many things that you can be involved in or that you do, how do you prioritize one thing over another? We can talk about that from your role as the chief operations officer, but you can also talk about it from your perspective of being on a number of boards and being involved in a number of organizations. How do you prioritize your time? What do you choose and how do you choose to do what you do?
That's a good question. Sticky notes, my friend. Sticky notes is my buddy. OneNote, we upgraded our IT system, so I try to put things in OneNote. If my boss said try to check the boxes, I try to check the boxes. If I know something is urgent, I try to put it at the top of our list. Our administrative assistant, Latoya, I lean on her a lot to try to help. Technology is great. So I used to keep two separate calendars, a personal calendar and a work calendar. No, they have to merge now. They've been merging for a while, so I have to merge those two calendars. So a lot of teamwork too. A lot of teamwork goes in place. And just being a mom, you know, you have to learn how to delegate. That's hard for me. Delegation is really hard for me. I'm getting better at it. And I mean, just being truthful. I'm getting better at delegating. A lot of times I try to take things on for myself and just do it myself because I know I'm going to do it. But I'm learning to delegate, and I have done a better job of that in the past couple of years. Especially, like I said, COVID came about. It's like you can't do everything yourself. And so I've had to kind of push back and say, hey, let me ask somebody else, can you do this? And I have a huge board in my office. And I have a section that's current projects, a certain section that's issues. And so that's how I just kind of check off so it can stay in my face what's going on and what needs to be done.
And thank you for reminding us that in addition to all of these other things, you are also a mom and all of the responsibilities that continues to carry. I mentioned in the introduction, Dr. Burton, that you're an adjunct professor at the University of Alabama. Can you tell us about what you do in that role and your involvement in teaching and education?
Yes, in 2019, I was asked by the chair of the department at the time of health education to help come and fill a class on health disparity. And so I did that as she asked me to, and it was wonderful. I love talking to the students just to give them a real life view of what it's like for health disparities. We see it all around, but a lot of times we don't recognize. And so that's how I kind of aim my class so they can leave the class, not at the end of the class when the semester is over, but when they left that night. How can they see the disparities in their community? How does things impact? And so part of that was, let's just say, prime example, we talk about pharmacies. Look at how pharmacies are placed in the community. One part of the community had two pharmacies right across the street from each other. The other part of the community where socioeconomics is not such a high thing, there's one pharmacy. Grocery stores. How many grocery stores are in a social, economic, maybe health disparity area? Some none. Some maybe one. And a more higher socioeconomic area, you have flooded from grocery stores. You can even have someone to deliver the food for you. Some places don't have that option. Rural places don't necessarily always have the option. They have the one grocery store, they may have a one doctor. And so I try to get the students to understand those are parts of health disparities. Those are parts that may be the reason why that person's blood pressure is high, because they don't have a park that they can go to the wall. Or they may not think that it's safe to go outside of their home to just exercise around the house or something. So when I did the course I taught at UA, that's why I'm trying to get the students to recognize. And a lot of students came to me after and said, no one ever put it to me like that. And so I really, really enjoy talking to students. Now, my role with UAB as adjunct is just, they're changing their programs. And so just kind of give them some feedback on how they're changing of their programs, impacts the relationship with community health centers, whether I allow students to come over and shadow me for a day or two or a week or what they have. So if they want to learn something about health education, they could be on one of the projects that we're working on. They could be a catalyst to help facilitate a project. That's my role right now.
Well, what I'm hearing in all of this is your focus on and your interest in addressing social determinants of health,
Yes.
which our students here should be very familiar with.
Yes.
And that's critically important means of addressing health disparities, is
Exactly.
pushing everything upstream.
Exactly.
To your point about why your patient may end up this way or that way, and to try to keep walking it back. I'm reminded of a piece I used to do with medical students in Tennessee, third and fourth year medical students, entitled "Why My Patient Didn't Show Up for Clinic." And it's not just a matter of, well, you know, they don't prioritize coming to the clinic.
Right.
Well, let's start peeling this back. They didn't have transportation together. Why not? Couldn't arrange transport. Why not? And keep why all the way back upstream as far as you can go. And eventually getting people to understand that life is so much more complicated than what it appears on the surface. So thank you for all of that. I really appreciated your comment of we see health disparities, we don't recognize them. They're right in front of us, but
Right.
we can't really recognize them. So thank you for that. I'm going to pull you back to UAB for a while now. So back in 2006, 7, 8 time period, what were some of the experiences or opportunities that you participated in while here at UAB that helped make you successful in your career?
Well, I had a strategic planning course. That was good.
Was that with Dr. Pete Ginter by any chance?
Yes, it was.
He's still here.
Still teaching the same book.
That was good. There was a concierge medical practice that was opening nearby. And we had to divide up in teams and kind of give our ideas of how he should strategically market and what does that look like, a concierge medical practice. That was 20 years ago. Now it's like, to me, it's like a fancy name for telehealth. And so that class was good. I used a lot of that when it came to managing COVID. And just like every day. Some other courses, health economics, policy class. Oh, so on point right now because I do a lot of contract reviews. That's my everyday. I review contracts, get in touch with our legal team, discuss contracts with them, see if it's a need for our staff or benefit for our patients. Review presentations, have to come up with procurement policies, travel policies, mileage policies, political policies, admin policies, policies. So health policy was my track. That was my track. So a lot of that. Ethics class I took. Actually, my husband and I were both doing our masters here at the same time. He was doing MPA, I did an MPH, and we took a joint class on ethics. That opened eyes. You took that class? Yes. You had a visit to the prison. No. We went to the prison.
Would you like to?
We went to Donaldson Correctional Facility. We spent the day there and then we went downtown here on the south side to the abortion clinic. And we spent time across the street just to watch the interaction between the people who were for abortion, who were against abortion. In the jail, they told us certain things to wear, certain things not to wear. And we spent the day in Donaldson. And those things were very eye-opening for me. And even to this day, I talk about that with some people that come through, that how those things impact what I do now. From a prison standpoint, I didn't know that at the time. I wasn't an admin, and in Watley we had a jail, and so and then my husband's police officer, he loved it. He loved it. It was wonderful. That's his world. For me, it was impactful just to see how people who were confined within walls can be so creative. They would just make the most beautiful sailboats and things out of nothing because they couldn't have any weapons, but they made weapons. But then at the end of our whole tour, we went through the kitchen, the inmates cooked the food, the inmates just kind of see their interaction with each other. We went on death row. We talked to a guy who was on death row. They leave the Alabama code books along the hallways of death row so they can study. They have nothing else to do. So they can study the books. A lot of them, try to plead their case why they shouldn't be there. We got to see what it looks like, the living quarters and things. So that was totally eye-opening. But at the end of our visit at the prison, there was a guy who was kind of seen as a senior leader within the prison. And we went to the library and all seats were blocks, cement blocks. Okay. Their beds are cement blocks, basically, with mattresses on top. And the guy who came and spoke to us at the end of our tour, he said that he started off there at the prison. Of course, nobody really goes in. Most people don't go in detention. Some people do because you get health care. And you get meals. And so some people, they don't have anywhere else to go, so they may commit another crime just so they can go back. Well, this guy, very long story, I'll make it short of it. He had done one crime, ended up down at jail, and he was a student at a college, at Stillman College. And then he did another crime, ended up in prison down 65 South. Then he said he was running around with the wrong people though. And he did not personally commit the crime. He was with some people who did commit the crime, so that made him guilty. And so when the University of Alabama, they had a ministry at this time, they would go to the prisons and they met him and they told him, well, since you got some college credit already, you come out, you could come back to the University of Alabama to finish your degree. Well, needless to say, he did not finish his degree. He ended up getting called up again and he was there for life. He has a life sentence. And he said, I grew up in McKenzie Court. That's shocking. You shaking your head. You know exactly. Because I work across the street from McKenzie Court. McKenzie Court, right there where you are with that tan peach shirt on, that's McKenzie Court for my clinic. I see McKenzie Court every day. And that stuck with me. And he said he only talks to his family on Sundays, by phone on Sundays. And so that whole premise of his thought, his mental process, and now how he has tried to be a mentor to the younger people that come in, that stuck with me, and that will forever stick with me. But that was a class 2 here at UAB that I took that really impacted me. I also took an accounting class because I knew I wanted to do administration. So I took an accounting class. It was not my best, but it was accounting. My sister is accounting, my brother's in finance. I thought, oh, it's in me, it's in me. Thank God that we have a CFO, a controller who does a great job. So we lean on them a lot. But those are just some courses that here that I really like. The maternal child health class was wonderful. And the core classes too, just to see the history of public health from the Tuskegee experiment moving on to smallpox and things like that. It was just wonderful.
Wow. Thank you for reminding us that people behind bars are human beings. Thank you for that. Well, let's sort of take a pause and see what questions you have for Dr. Burton. Dr. Waterboard.
Dr. Burton, a pleasure. Real quickly, I know some people, the ones I know, I'm talking about kind of older people, that they have a doctor, and I say, when do you see your doctor? It's a chiropractor. Now, a lot of what you presented didn't sound like chiropractic to me. So, two questions. In your academic curriculum to get your degree in chiropractic, do they go over stuff like you may be in a position one day to be kind of the first line healthcare? You should know something about COVID and high blood pressure and all that. Or did you pick that up from your MPH or from neither one? Because MPH is not focused really on. So, another question, like, how do you know everything you know?
In chiropractic school, they do teach us that you may be the only doctor in the world.
Okay.
They teach us that.
Good.
And so they say we did take a course on how to deliver a baby.
Oh.
Yeah, we had to take a course on how to do a pap smear. So
Wow. I'm surprised, but that's what I wanted to know.
even though they teach us that when you get out of school, insurance and malpractice says no, you can't do that.
Yeah.
You gotta work your hands to deliver a baby. You just do it out the goodness of your heart. You just never know. If you're a doctor in a rural area, then you're the only doctor in the way, and you might have some assistance. So they don't teach us per se those things, but they do teach us about disease processes and states. There's a lot of CNS. CNS. Wow. Okay, yeah, there's a lot of CNS. Autonomic, a lot of nervous system stuff. We learn a lot of nervous system things. The classes on quarters, so we just like class on overload. 25 hours per quarter was just low.
Wow.
Yeah, overload. So it was a lot. But the other part is I taught myself a lot. Because I am anomaly. When I got to the community health center, the CEO at the time said that they needed health education. And that's one thing chiropractors build on is health education.
Okay.
We learn a lot about teaching people about health. And so, and nutrition. We had to take a couple nutrition courses. And at the time in medical school, nutrition wasn't taught. And my counterparts would tell me they don't teach us nutrition. They teach you nutrition. So I taught the diabetes classes. And so I would teach the diabetes classes in between on my lunch breaks. Wow, first for one Friday. God, what did I used to call it? I had to do a kitchen name for it. But we had diabetes class once a month. And then we started something called 3-3-30, where we try to get people to eat 3 meals a day, 3 times, exercise 3 times a week for 30 minutes. And so I taught myself a lot. And even when it came to research, I came and did CCTS here. When I started for a project and started seeing, okay, I'm talking to a lot of researchers now. I came and visited CCTS a couple times, probably for about a good 6 months. Then one of the professors, Dr. Martha Crawford, asked me about coming to a RICMAR conversation, and that's the Deep South research with UAB and UA and Morehouse and Tuskegee. And so I just really kind of start immersing myself in what I do. And that's just me. I'm always a learner. I don't mind learning. To me, if you don't learn, and I use a lot of analogies with my patients. So to me, it's like this: if you hop on the interstate, you driving, right? If you go on 30 or 50 miles an hour, speed limit 70, you behind. Everybody passing you by. And to me, it's the same thing in my career. I felt like I need to get on the interstate, but I got to drive. And I'm going to have to go at least a good 75, 80. But I'm going to have to go, maybe 82. The thing is on.
And you see the red lights in your rear view.
stay in love or what I'm doing. Because if I stay riding at 70, if I stay riding at 60, I'm behind. And to me, with students, the same thing. You gotta continue to learn as you go forward. If you don't, you're behind.
Another quick comment, it strikes me that UAB is big on combined degree programs. I don't think we offer at UAB a Doctor of Chiropractic. You have an MPH. It sounds like a good, to make more of you. We can't put you in the Xerox machine. Training people who are interested in what you're interested in, health disparities, rural health, and have interest in MPH, and because you could survive economically, I'm sure, just being a chiropractor, but you do a whole lot more.
Right, yeah, I agree. I think there are some programs out there like that at other chiropractic schools who have merged that kind of degree program with other schools of public health throughout the country.
Dr. Alston, are you aware
I'm
of?
trying to think of
Yeah.
any. I haven't heard, but I will certainly be looking it up when I leave here.
Yeah.
Great. Thanks, Dr. Waterworth, for your questions. Other questions from folks in the room? Ananya?
I was still building off of what Dr. Waterboard mentioned. So being a lifelong learner and always trying to stay at that 82.
You gotta be careful.
Have there been any additional training or certificate programs that you've taken on voluntarily that haven't been a part of getting a master's degree?
I did a PMP here at UAB in the School of Business, so it's project management. I did that course, so I got my project management certificate here. One of the other jobs I held in Watley was the director of healthcare quality. And so as I started doing that job, I looked at a NACQ. And that's a certificate in healthcare quality. And so I started that and worked on that, and I did not finish it, my certificate, because I moved into the COO role. So that I only did that healthcare quality officially for like a year and a half. And then my current CEO, David Gay, came into play in Hawaii. He's been out there like 4 years. And so as things progressed, he needed to fill that role, because that role, the COO role, had been empty for a little while. So, ironically, I was student forward. So I applied for it and got the job. So I do have intentions to finish my healthcare quality. We do have a director of healthcare quality right now. I shared all my books and things to her, and I told her she's RN. She's been with me for a long time in Watley, and as she's moved into this role, I'm encouraging her to be the best quality director that she can be.
Excuse me one moment. Ebony, do we have any questions from our online?
Do you have a favorite book? And if so, what is it?
You have a favorite book, and if so, what is it?
Living a Catastrophic Life. It's by a psychologist. And it's huge. It's a very big book. But I really like that book at the phase of life that I was in. It really gives you a lot of tools on how to look at life differently. And especially after having breast cancer at such a young age, you have to realize that you have, and not only having cancer, but everybody goes through something in their life. And you have to realize at some point, some things I can't control, but I can control how I react to those things. And so that book was a good help. That's probably most recently.
Another?
Can you elaborate more on the grant that you are working on using chiropractic services as an alternative for pain medicine? How receptive is the SA, FPV population to participating? What metrics are you using? Is there any incorporation of Medicare or Medicaid or the funding source after the grant?
Okay.
ABC. 5 questions.
We still have one question from the audience, so mindful of time. Thank you.
The current grant that we're working on, like I said, it's primarily with the University of Alabama and Rebecca Allen is the PI. It's really looking at patients with OUD and SUD. It all depends, and this grant kind of, to me, piggybacks on the PCORI grant. I know I keep going back to PCORI, but that was pain related this week. And so the OUD and SUD is usually pain related. And so to me, it's all about the practitioner that's referring the patient. If the practitioner has a good relationship with the patient, if the patient trusts what the practitioner says, you will get more engaged. So to me, it's like when I refer a patient, or if one of the social workers that the patient has had a conversation with, if they trust that person, they will participate. If they don't really trust that person, they won't so much participate. It's because the patient has to feel that you have a vested interest in. I have noticed a lot of times, I know a lot of people put up flyers or put something on the web to try to pull research subjects. But we get a lot of people calling us about research because we have a lot of patients. And so we don't mind partnering on research projects if we see it's going to be beneficial to our patients. That's number one thing. But if you get some people within the organization engaged to kind of be part of the research study, to me, it makes it more fulfilling. On the Medicare and Medicaid side, I'm not quite sure. I'm sure they will, they reimburse for chiropractic. Medicare does reimburse for chiropractic. Medicaid not in the state of Alabama, it's only a secondary, not as primary. But OUD and SUD is so big right now. Their need is so great for mental health providers, from whether it's clinical social workers to psychiatrists or nurse practitioners who do mental health. And so those things are reimbursable by insurance at this point.
Thanks, Ebony. And so we have one more question from the audience. Yes.
Some of the question is related to Dr. Curran. He mentioned that you were a success story because you stayed at Watley. So what made you stay at Watley and you probably had other practices?
The patients. I can't go anywhere until God tells me to go. That's why I always say. And so while I'm there, I always got to give the best to where I am. That's just me. I try to tell my kids the same thing. You may not like what you're doing right now, but you give the best to where you are. And so I continue to try to, whether it's in an admin role or as a clinical role, I always try to give the best to my patients. Where I am currently now, I'm probably the senior provider there. Working in health spaces is not easy. You got to pull a rabbit out of a hat. Like, and some of my student athletic training skills are trying to make a insole for a person out of some cushion that came out of packing. I've brought that same skill to Watson. Someone who doesn't have the money to go and buy insoles, who don't have the insurance to go and buy insoles. How do I make them insoles? How do I create a sling for them when they, have a hurt shoulder or a broken or a fracture or just can't function? So that's why I say I can't leave until the man above tells me I can go. But while I'm there, I do this. I can look at what we do.
Thank you so much. Just one final request, and particularly for our students here who may feel unsure about their future goals. How would you encourage them to explore their prospects?
I would say don't be afraid. Don't be afraid. Be open to opportunities. Don't take yourself too seriously. Okay? I used to do that. Don't take yourself too seriously. And the bottom line too, don't burn bridges. Do not burn bridges. God has a sense of humor. He has a sense of humor. When you say you never thought you would do this, look at 3-4 years down the road, look what you're doing. And you may have a conversation with yourself walking across the street on a rainy day. look where I'm going to now. Like I said, I'll never do this. Never leave a job without giving a proper notice. We see a lot of that happening now. It's not only us. I talk to beauticians. I had private practice guy in my office last week. He said the same thing. Always, be generous, be thankful, and never burn bridges. Never burn bridges. Because you never know, you leave a job and then 2-3 years later, you need to go and apply for a job. You walk in that room, that same person that you didn't leave right with, sit right there in front of your face. And you just gonna be like, no, never burn bridges.
Well, your bridge to this school is strongly intact. Please know that. You are an inspiration to all of us.
Thank you.
Thank you for sharing this time with us, your insights and wisdom. Please join me in thanking Dr. Toyota.